Hey everybody, welcome back. We're doing an old school What's for Dinner. Hope you guys are doing fantastic and having a blessed day so far. For those of you who don't know us, I'm Mark. I'm a certified health coach here behind the camera, and this is Teresa. She's a board certified family nurse practitioner. We are with Total Health and Wellness, and we like to talk about hormones, metabolic health, and everything in between. So I just showed you guys really quick what we were doing for dinner. It's our usual, hamburgers. And did you want to say anything about the food that we had?
Well, this is another reason we call ourselves ketovore, because we leave about 5 to 8% so we can have onion and tomato, a little bit of lettuce here and there. We do vegetables on Sunday, coffee, rosette stomachs,
Yeah,
that kind of stuff.
and herbs and spices.
Right.
Right on.
Is anyone watching? Can they hear you?
I hope so. Anybody watching there, let us know if you can hear us. Make sure you guys can, because we've got the microphone situation set up off to the side. Hopefully they're working and everybody can hear us loud and clear. All right, so I am right up in your grill. So
You are, right?
sorry about that. I just want to stay close enough to the cameras, or I'm sorry, the microphones. All right. So what are we talking about tonight, hon? What's the title?
I have a case study. 37-year-old female. She actually first saw me back in September of 2021 and didn't really last very long. They opened a business. Adulting is hard.
Yeah.
Real life.
It gets in the way sometimes.
It does. So she came back to me last week, and I just reviewed her labs for her follow-up. So she's 37 years old. She has a history of polycystic ovarian syndrome, PCOS, which is insulin resistance. Okay, at the root cause, PCOS is insulin resistance.
What are some of the signs and symptoms of PCOS? What can people expect?
Well, textbook is weight gain, hair growth on the face, thinning on the head, acne, infertility, miscarriages, ovarian cysts, those kinds of things.
Okay.
Honestly, I mean, this sounds funny, but they probably were the bearded circus ladies back in the day.
Got it.
They had beards.
Okay. Are you going to get into treatment for that?
So treatment is food, diet,
Yeah.
and then progesterone. But she also had a history of a uterine ablation in 2019. So that's when they go and burn your uterus so it stops bleeding. So I got her labs back. So corporate medicine is going to miss this every single time. Okay. So her A1C, which is corporate medicine's diagnostic test for diabetes, by the time you get diagnosed with an A1C elevation, you've been sick for about 15 years. So they don't care though. Their model in sick care, corporate medicine, is you get a diagnosis and then you get a pill. So you get an ill and you get a pill. So they wait for the A1C to get elevated and then they give you a pill.
Gotcha. Oh, thanks, Jeannie. She said she can hear us.
Yay. Okay. Well, you are kind of loud.
I am. I have a projecting voice.
You and the boys, I don't stand a chance with my little voice.
It's a commanding voice. That's all it is.
Okay. So her A1C is 5.4. So anything below 5.7 is normal. And that's all they run. Okay. They aren't going to run anything else. So she's going to be told she's normal, even though we know she's insulin resistant because she has PCOS. I do not have her weight down. Okay. And then her liver enzymes are completely normal, but one is elevated. Okay. So there's two, the ALT and the AST. One is completely normal at 27, the AST. The ALT is elevated at 47. Back in 2021, her liver enzymes were completely normal, but I could see back then the ALT is pulling away from the AST. ALT was 29, AST was 22. So they're pulling away. Now, ALT is 47 and the AST is 27. This is non-alcoholic fatty liver. Now, someone could say something because the ALT is out of range high, because that range only goes up to 29, but I could see it coming in 2021.
So is it like the divergence between the two?
Divergence.
Okay, that's what indicates.
You can look at it a lot of different ways for like hepatitis, medication hepatotoxicity, or fatty liver.
Okay.
And then her fasting insulin, this is a dead giveaway, but corporate medicine does not run this. Her fasting insulin is 18.5. The cutoff, even for sick care, is 18.4. So she's 18.5. So she's insulin resistant. We already knew this because she has PCOS. I forgot her weight, and then her uric acid, which is in corporate medicine, they use this test to test gout, to diagnose gout. She's at a 7. I use it to look at insulin resistance. She's at a 7 and the range stops at 7. She's at the very top, insulin resistance. And then the other thing she has going against her is she has an elevated ferritin, which sometimes can mean hereditary hemochromatosis, which I do diagnose a lot because I run ferritin a lot. That's a genetic disorder where you essentially have too much iron and you rust yourselves from the inside out. So her ferritin is 239. I have a feeling it's inflammation, but what I usually do is run it a few times, and if it continues to be elevated, give the patient the option to test for hereditary hemochromatosis. And I can't remember, but I think it's like $110 my cash pay. It's a genetic test, so your insurance, I'm going to guess, is going to get charged like $1,800. But you only have to run it once because you either have it or you don't. Okay, so back in 2021, her A1C was 5.2. Again, totally normal. No one's going to blink about this. Now it's 5.4. Her fasting insulin, though, back in 2021 was 9.1. So I want 3 to 5 and below, but anything above 10 is doing damage. So she was 9.1. So you could see it coming. So now here she is 4 years later, and she's only 37. But 4 years later, she's full-blown insulin resistant. But corporate medicine would probably miss it for another, I'm going to say, 6 years or so.
Got it. So if they had been doing their job and they had been trending those labs and watching the trending lab scores and whatnot, they would have been able to indicate or determine that, oh, okay, she's becoming insulin resistant.
Yeah. And I don't have her triglycerides and HDL back, but that's another thing you can look at.
Yeah.
I can tell when patients come in because I can see that sometimes their belly is double the waist circumference is double the height. So not to be judgy, but that is another quick way that you can measure yourself. Your waist cannot be more than double your height.
Yeah.
In inches.
Or you can stand against the wall, and if your belly touches before your toes, if you're standing straight in front of it with your face to the wall, that's another good indicator. So if somebody came to you and said, "Hey, Teresa, I want to see you for fat loss, weight loss. I'm interested in doing low carb and stuff." What would you tell them? And also, go over all of the tests you would want to run for just specifically the metabolic health side?
Oh gosh. Well, first of all, I tell everyone they need low carb because we all eat too much sugar. Go back and look at our video. I think it was last week. We did a meal of the way we used to eat in the 2000s, and it was 383 grams of carbs by the end of the day. And that was not even including like a nighttime snack while you're watching TV. You can't burn that unless you're an Olympic athlete. So everyone gets put on a low carb diet or suggested. PCOS, I always tell them the answer is low carbohydrate, 30 grams or less a day. There's really not much wiggle room with that. So in the labs are just, it's a lot. So specifically for insulin resistance, I look at triglycerides and HDL ratio, uric acid, GGT, which is another liver enzyme, liver enzymes, your HOMA-IR score, which is your fasting insulin and your fasting glucose, which hers must not have been elevated because I don't have it written down. So that's another reason they'll miss it. I think that's probably it and hemoglobin A1C, of course.
Yeah.
Specifically for metabolic disorders. Now we run like 14 tubes of blood, which is a lot, but not exhaustive.
Well, and most of the patients that you see coming to you aren't here just for metabolic health. They're just you also for hormones. So that's a whole nother panel and group of tests. And then you have a lot of folks want to come in. They want their vitamin D. They want their magnesium. They want to know all these different things. And we have a pretty good sized menu of tests that we can choose from to run for people.
Yeah.
So we allow a lot of input from the patient, right?
Yeah. So. Always. But she's only 37, but she has pretty significant insulin resistance. I should have figured out her HOMA-IR score, but it doesn't matter because I already know she's insulin resistant because of the insulin. But at 37, this is not unheard of because she has PCOS. She can fix this and will work really hard because she feels terrible.
What's crazy is that there's actually multiple indicators you can use to determine if somebody's insulin resistant, and but corporate medicine only looks at hemoglobin A1C.
It's the standard of care.
Yeah, it's just all these options they have that they can determine what's going on with you, and they can help you, and it just doesn't happen.
Yeah, and I've been saying, every single new patient I get frustrated with, and I have a case study that I'm going to go over with you guys next week of a young woman who told me she feels like she's dying slowly. Well, I started crying because that's a lot. When someone says that to you, and I just think so many times lately, I've just been saying, you people need to do better. And the people I mean is corporate medicine.
Yeah, for
if
sure.
You're a provider treating humans, we need to do better because we treat people nicer. What I come home and say to Mark all the time is the way these providers treat these patients, you and I, so Mark and me, treat people at the grocery store better than these people are getting treated at a provider's office and clinic that are supposed to care about them, and they're paying them money.
Yeah.
to see them.
where the insurance company is, and that's where the disconnect comes there, because there's not really an incentive. The patient isn't actually handing them cash.
Right.
It would be a different story if they were.
Right.
So, all right. Well, as always, guys, this should not be considered medical advice of any type. If you guys need to, if you want medical advice, just reach out to your highly trained and knowledgeable healthcare provider. Links to those types of providers are in the description and/or comment section. And did you have anything else you want to talk about? Hey, I know. I have a question for you.
Yes.
Will any of this delicious food that we prepared tonight cause our insulin or blood sugar to spike? And why is that important, Teresa?
It will not. And if
Okay.
you don't want to be insulin resistant, then you don't want to spike your insulin constantly all day long, every single day of your life.
Okay.
For years and years and years.
All right.
So.
All right. Right on. All right. Well.
But also, before you ask your highly trained and knowledgeable, make sure that they had nutrition training where and hormone training and where, because they don't.
Great locations to look for hormones is worldlinkmedical.com, and then also for the metabolic side or the weight loss side of things is the lowcarbusa.org or the smhp.org. So, but again, all those links are in the description and comment section. So, along with lots of other ones. So please go check those out.
And now's the time to sign up for Low Carb San Diego in August. Go do it now.
See
virtual or in person.
Yeah, it would be awesome. It's going to be in Coronado this year. So we're super excited. Well, in a way, we're going to be sad because we love our little location right on San Diego where we were doing it before. But
it's just across the bay.
It's just across the bay. But still, Coronado is going to be a lot of fun. Be a little bit more beachy.
Yep.
So, all right, guys, as always, we love you. God bless you. We'll see you next time. And don't forget, food matters. Bye guys.